important it is to actually think about spirituality in everything that we do. It's been such an important driver for me to do things with purpose in my life as a physician, board-certified psychiatrist, wife, mom, grandma, and entrepreneur, so to speak. So I think it's so important to make sure that we always keep this in mind, and I thought it was going to be an interesting point to try to discuss spirituality in the context of medicine and AI. And I wish we had more information than what I'm going to chat with you about, because it's more like a flow of consciousness in a way, to try to figure out, well, why is it so important for us to make sure that we drive through purpose and not just trying to figure out, a new startup just so that the mega yacht is at the end of our quest, instead of really trying to bring good to the world in everything that we do. I see some heads nodding here, so it aligns, right? It kind of goes like, yeah, we should be doing stuff that's really good for everyone, right? Rather than just something that's gonna, just fulfill some great needs to advance technology. What if we can put everything together in the best interest of people while we try to do all of this? So I think there's so many opportunities to do this. My first experience in even looking into databases and aggregating data related to my being a researcher at the NIH. I was a researcher in mood and anxiety disorders, and really fascinated, honestly, to just try to be able to build even a data set on Excel in the 1990s. Like, we didn't know better at the time, but that's the way all of this gets started. Like, we're trying to do good, and how can we do good with one person at a time? We need to kind of aggregate a lot of what's going on so that we can better understand that. I've also been fortunate to work in clinical insights and analytics at different levels in different companies, and that's what first led me into getting certified in AI in 2020. I was like, I want to look and understand better everything that has to do with insights. How can we do that? I wasn't just interested in health and wellness in the mental health part in psychiatry, but in health overall. Like, what if we were able to aggregate a lot of data from different practitioners caring for different people across the US and across the world? Like, what if we were able to really better understand what it is that people need so that we can provide for better care for them?